Gloria Nawayaga, a human rights lawyer, is among several individuals who have courageously declared their HIV status. Gloria, who was born with HIV, has come a long way from a time she despised herself and contemplated ending her life before accepting her situation and thriving in her life. Her mother disclosed her status to her when she was in primary 4.
I lost hope because I thought I'm going to die. I hated myself. I hated my parents. I hated everyone at home. And I also even tried to commit suicide, but I'm glad I'm still alive.
However, the journey towards self-love and adhering to daily medication has not been easy for Gloria. During her A-levels, she resorted to a 40-day fast, hoping that her HIV status would change.
Not taking drugs, no eating, it's just dry, because I want God to do what? A miracle. What happened was, I got HCP. I don't know if you have ever heard about HCP. Yes. I've never gotten such pain in my entire life because the other thing was very painful. I could not wear my clothes. I could not sit like you see me seated here. I could not bend. I could not walk.
In 2017, after winning the Y+ beauty pageant, Gloria disclosed her HIV status to the public. She disclosed her status after the stigma and discrimination she had experienced throughout her upbringing and during time at the university. She wanted to utilize her platform to inspire others and encourage people living with HIV to live positive lives. According to the Uganda AIDS Commission, many living with HIV are suffering from self-stigma as well as societal stigma and discrimination. This is happening at a time when Uganda is striving to achieve the goal of ending HIV by 2030.
No new infections, no deaths as a result of AIDS, and no stigma and discrimination. But we shall still be having people living with HIV because we have no cure. Currently, we have no cure. We have no vaccine.
Dr. Joshua Musinguzi, the program manager of the AIDS control program, stated that one of the Ministry of Health targets is to reduce the incidence of HIV/AIDS to what are deemed acceptable levels.
That you bring down the number of new infections that are occurring below the number of AIDS deaths in the population of people living with HIV. So that once the new infections drop below that, it means that the population of people living with HIV and those that will be getting AIDS and dying will actually begin to substantially contract.
There is a need to boost awareness and scale up prevention as well as treatment.
There are people who are not able to access services in the same way others access these services, either because they don't know that those services exist, they don't know, they don't have a knowledge of the services, they don't know where to get the services, or the distance, or many other factors that could be affecting their access to services. So we have new goals, we have new targets.
The Uganda AIDS Commission says it is advocating for a larger funding from the government to ensure sustainability. Uganda is still registering new infections and death. As per Uganda AIDS Commission data, an estimated 1.4 million people are living with HIV, and last year, Uganda registered 54,000 new infections. NOBERT ATUKUNDA, NTV News.